Every single country on the planet with a limited amount of money has to answer one of the toughest questions there is. What is a healthier life for its citizens actually worth? Today, we're going to peek inside the new rulebook that's trying to answer that very question.
Okay, so let's get right into it. Picture this. A brand new life-saving drug hits the market. It's a miracle, but it costs an absolute fortune. How does a government, any government, decide if it's worth it to cover that cost for everyone? I mean, this isn't just some late-night dorm room debate. It's a real pressing problem, and officials use a very specific toolkit to figure it out.
For this, we're zooming in on the Netherlands. Now, these guys are seen as real leaders in this field, and they've just rolled out a major update to their rulebook. That's the official guideline they use for making these incredibly tough calls. Think of it like the operating system for their entire healthcare spending.
Now, this formal process has a name. It's called a Health Technology Assessment, or HTA for short. It's basically a systematic way to weigh the costs of a new treatment against all of its benefits. And to make sure these evaluations are fair, consistent, and based on solid science, countries use these detailed guidelines, just like the one the Dutch have been fine-tuning for years.
And what's really interesting here is that this is not some new idea for them. The Dutch have been at this since 1999, always pushing for what they call a societal perspective. The last version came out in 2016 and was the standard for years. But this 2024 update, well, it's a massive leap forward, bringing in all the latest thinking in health economics.
So what's actually new? Well, you can kind of break down the changes into two big themes. First, let's dig into how the Dutch are upgrading their very definition of value by using a much, much wider lens. And this slide just lays it out perfectly. The old way of thinking was laser-focused on the patient, their medical bills, and their health. Simple enough. But the new view? It zooms way out. It says, hey, what about the patient's family, the people caring for them? Their quality of life matters. And what about costs that pop up in totally different places, like special education or even the justice system? Yeah, those should be part of the equation too.
This quote from the research paper just nails it. This isn't some small accounting trick. It's a huge shift in thinking, trying to capture the full ripple effect of an illness and its treatment across every part of society.
So here's what that actually looks like in the real world. If a new dementia drug helps a patient stay at home longer, which in turn reduces the stress and improves the health of their spouse, the new Dutch rulebook says that has value. That counts. It's even more honest about the whole picture, accounting for the future medical costs a person might have in the extra years of life they gain. All right, so that brings us to the second big theme. It's not enough to just see a wider picture. You also have to make sure the math you're using to analyze that picture is as smart and up-to-date as possible.
Now, this might just look like a number, but trust me, this is a huge deal. This is the new discount rate for costs. It's been lowered from 4% to 3%. In simple terms, this pretty technical change means that health benefits you get in the future are valued more highly today. It's like saying a healthy year of life 10 years from now is almost as important as one you get today. And that gives way more weight to things like preventative medicine or cures that pay off decades down the road. Another massive change is how they deal with uncertainty. See, before, a lot of analyses were based on a single best guess for all the key numbers. Now, they've made something called probabilistic analysis mandatory. It means their models have to account for a whole range of possibilities, not just one. Honestly, the best way to get your head around this is to think about a modern weather forecast. An old model might just say, it's going to be sunny. But a new probabilistic model says, hey, there's a 90% chance of sun, but also a 10% chance of clouds. See the difference? It doesn't just give you an answer, it tells you how confident you should be in that answer. And that is way more useful when you're making a massive decision. And building right on top of that, they've now made something called value of information analysis mandatory. This forces people to ask a really critical question. Given how unsure we are, what's the potential cost if we get this decision wrong? And, maybe more importantly, would it be worth spending more money on research to get a clearer picture before we say yes or no? It's a structured way to avoid making some very, very expensive mistakes.
Okay, so the Dutch updated their guideline. It's more comprehensive, the math is smarter, great. But why should anyone outside of the Netherlands actually care? What does this all really add up to? When you lay it all out like this, you really start to see the bigger picture emerge. By recognizing the burden on families, they're making this system more humane. By valuing the future more, they're making it more forward-thinking. And by demanding better, more honest math, they're making decisions that are not just smarter financially, but also more scientifically and ethically sound. And that's why this matters. Because the Netherlands is such a respected leader in this area, their new guideline basically acts as a blueprint for other countries. You can bet that health economists and policymakers all over the world are going to be studying these changes very closely. This isn't just a local update, it's a signpost for where the global conversation about healthcare value is headed. But here's the thing, even with this groundbreaking update, the very experts who wrote it are already looking over the horizon, asking, okay, what's the next big challenge? For decades, the gold standard for measuring value has been this thing called a quality adjusted life year, or QALY. But the researchers are pointing out a really interesting problem. Some treatments, especially for older adults, might not make people healthier in the way we usually measure it, but they can dramatically improve their overall well-being, their ability to connect with family and be part of their community, and right now our tools just don't capture that value very well. And that leads us to this final and honestly pretty profound question. Maybe the next frontier isn't just about getting better at measuring health, but about expanding our view to measure well-being itself. It's a question that pushes all of us to think bigger about what we truly want from our healthcare systems and what a good life is really truly worth.